Last week, as the President said, we issued an emergency use authorization to allow the donated hydroxychloroquine to come into the country and enter the general circulation. We are prioritizing this drug to come in for clinical trials, also into general use for physicians, because as you know, physicians, based upon their interaction with the patients, their assessment of the risks and benefits, can write a prescription for hydroxychloroquine if they think it's appropriate for the patient. Being a physician, we do this all the time, and that assessment needs to be done between a patient and a doctor. And then the third portion is we wanted to make sure that these drugs were in the circulation, in the supply chain, so that people who have them or need them for the other indications, lupus, rheumatoid arthritis, had them available. So that was the purpose of the emergency use authorization. One other thing I'd like to mention is that we on Friday stood up a formal convalescent plasma program. We have a great deal of enthusiasm for that. There are some reports that this is of benefit to patients in other countries who have had the COVID-19 virus. And what this means is taking plasma from patients who've had the virus and who have recovered and transferring the immunity, the immunoglobulins, if you will, the immunity from that person to someone who's sick. And we're hopefully expanding that across the country. The Red Cross is involved in that program, and I think it shows great promise. It needs to be studied like other things, but just like I said before, it provides hope. We don't want to provide false hope, but definitely hope. Thank you.